According to the National Institute of Health, tuberculosis kills almost 2 million people per year worldwide, despite being a curable disease. A large number of these deaths are in impoverished areas that, due to structural violence, are unable to provide treatment to these patients. Organizations such as Partners in Health, which was co-founded by Paul Farmer, helps patients in rural areas have access to these medications and treatments. Today I'd like to talk to you all about Paul Farmer's life and some of his accomplishments. As a community and public health major, I was inspired by Paul Farmer's work beginning in 2018. In 1990, Paul Farmer was awarded both a PhD in medical anthropology and his MD from Harvard University, though his work in the field of public health began long before his graduation. Paul Farmer's early life was greatly impacted by his later work. Paul Farmer was born in October of 1959 in Massachusetts, and during his early life, his father moved the family around a lot. At one point, the family purchased a bus to use for family vacations, but the bus ended up being a home to the family for 5 years. During this time, Paul was in high school, and he observed the plantations where many Haitian immigrants work under extreme conditions. This impacted his work later in life with Partners in Health. He was awarded a full scholarship to Duke University, where he earned his undergraduate degree, and after graduating from Duke, Farmer traveled to Miami, where he protested immigration policies that were discriminatory towards Haitian immigrants. As I mentioned before, Dr. Farmer's work in public health began before his graduation from medical school. Partners in Health was founded in 1987 after Paul and several of his colleagues opened a free clinic in the underserved community of Conge, Haiti. While studying at Harvard, Farmer was also working on opening a clinic in the beginnings of Partners in Health and splitting his time between Boston and Conge. The clinic opened in 1983 and it marked the beginning of Partners in Health. Some of the notable accomplishments in the early days of Partners in Health include inspiring the World Health Organization to revise treatment recommendations for multi-drug resistant tuberculosis after a successful program in Haiti, which provided an 80% cure rate to its patients, as well as the HIV Equity Initiative. Paul Farmer has had several different positions in the United Nations and continues to be involved in public health. Farmer served as Deputy United Nations Special Envoy for Haiti from 2009 to 2012. During this time, he helped Haitians face the crisis of the earthquake of 2010. After stepping down from his role as Special Envoy, he became the UN Special Advisor to the Secretary General on Community-Based Medicine. He concentrated on ending the cholera epidemic in Haiti. Farmer continues his work in health and educating community members. Currently, Farmer is a professor at a university and the chair of the Department of Global Health and Social Medicine at Harvard University. Paul Farmer continues to work with Partners in Health and assists in their COVID-19 efforts in Massachusetts. Dr. Farmer has made important contributions to global health. These contributions have greatly impacted the lives of many people, and today I'd like to leave you with a quote from Farmer that inspires all of his work. "The idea that some lives matter less is the root of all that is wrong in the world." Thank you all for listening.